kwiga ubumenyi inzira y'iterambere. Radio Imanzi 105.1 FM. Gusesagura n'ubupfapfa zirikana ko iyo mbimenya ari ijambo ribi maze ukoreshe neza imari yawe. Radio Imanzi 105.1 FM.
We got you updated. This is Radio Imanzi News in English.
You are tuned to Radio Imanzi, broadcasting from Kigali. Here is the news in English, brought to you by Fiona Umuganwa. The headlines. The government of Rwanda, in partnership with the World Health Organization Regional Office for Africa, has embarked on 3 projects dubbed flagship initiatives, which are expected to strengthen national capacities for preparedness to detect and respond to health emergencies. Medical students from different countries are in Rwanda to discuss how to develop medical technology post the COVID-19 pandemic. UN investigators say they believe Ethiopia's government is behind ongoing crimes against humanity in Tigray and warn that the resumption of the conflicts there increased the risk of further atrocity crimes. Welcome back. News in detail. The government of Rwanda, in partnership with the World Health Organization Regional Office for Africa, has embarked on 3 projects dubbed flagship initiatives, which are expected to strengthen national capacities for preparedness to detect and respond to health emergencies. The 5-year initiatives were launched at the Ministry of Health headquarters during a high-level meeting between the World Health Organization, Africa Region team and officials from the Health Ministry, among other partners. According to the World Health Organization, the 3 flagship initiatives will initially be implemented in a few select countries, including Rwanda, and later be scaled up regionally. Dr. Tarsis Mhunga, the state minister in charge of primary health care, said that the interventions will help African nations in capacity building in terms of preparedness to fight against disasters in general. In addition, he pointed out that over the past 2 years, there have been various lessons learned and challenges the country faced in terms of readiness in fighting against the pandemic amidst the global outbreak of COVID-19. Medical students from different countries are in Rwanda to discuss how to develop medical technology post the COVID-19 pandemic. Participants at the meeting say that the COVID-19 pandemic has shown that there should be more efforts in the use of technology. Although they are medical students, they contribute to providing different medical services in the community.
We don't have a very big developed digitalization health sector, but Rwanda is doing its best to promote it through different activity. Bubbly is a way of treating people, getting the health services without even going to the hospital, so they can be treated even online, only by calling. So I think Rwanda is putting much effort so that everyone can access health services, health facilities, without physically only, but also virtual and even using internet. Rwanda Medical Student Association of Rwanda, it's really emphasized on awareness and outreaches to communicate to the public, to give them a big picture of how they can prevent diseases. Not only teaching, but also giving the examples. We are youth, and you have to be the first to take the step to help the government in implementing different measures to prevent different diseases, not only the communicable diseases, but also even the non-communicable diseases.
Everything that involves technology, when you see where the world is right now, like we're heading in the technological era, like we're heading to the digital era. So if we're heading to the digital era, we don't have like the health sector should not be left behind. It has to go with others. So that is why we choose to focus on digital health, because we believe, or because like the medical students, they are the future healthcare providers. So if you are forming or when you are capacitating the medical students, then you are capacitating the nation.
I think international cooperation is really the foundation of improving healthcare systems, because we have a habit of reinventing the wheel everywhere we go. So like taking tried and tested innovations from different contexts and trying to apply them to your own system is a much more efficient way to improve your healthcare system than inventing things by yourself. So coming here, exchanging with students from all over the African continent is an amazing way to see how healthcare is structured here and what can be transferred.
We Africans were blessed with great minds, great brains. We are excelling in every field that you can ever imagine. I think it's very possible for us to. It's true that the pandemic was really a tight time for us. It was something new. We're not really prepared for it. But now we are post-pandemic. We're trying to regain our resources. It's slow, but we are going to get there. We are getting there already. So digital health, with our brains and every knowledge that the great minds that God has blessed us with, of course, is something that's very possible in Africa.
A professor at the University of Rwanda, Professor Stefan Rulesa, says young medical students are more tech-savvy and therefore having medical technology as a topic of discussion at this international conference that is bringing together medical students gives hope for the development of the health sector.
It's very key that we understand that we cannot do anything without digital. IT is here to stay, so we cannot afford anymore to assume that we can do business as usual without involving IT. So digital health, or digital health as a component, is very key to embed IT and digital technologies into health systems. We cannot operate health care as a doctors or healthcare professionals without employing IT. So it's very important that our students and our young doctors understand the role of digital health.
50 students from 7 African countries are attending the conference for the third time. COMESA's member states are set to join forces to strategize on policies to ensure that there is efficient use of solar power equipment to increase the number of households that are able to access electricity. A survey conducted by the Common Market for Eastern and Southern Africa shed light on the fact that power distribution equipment being of poor quality poses as an obstacle preventing their usage, which is further emphasized by their price range being too high for a product with its credibility that hasn't won over the consumer markets just yet. Fidel Abimana, the permanent secretary of Rwanda's Ministry of Infrastructure, gives an insight into the preventative measure the country has taken so far.
The quality of solar products are checked. You know, we have institutions that are in charge of this, especially the Rwanda Standards Board. However, it doesn't prevent us to work with other countries, especially the member states of COMESA, to harmonize and ensure that the quality standards cuts across all the member countries. And we also make sure that we harmonize the customs duties and tariffs, which are not now harmonized. And this is affecting the way trade is done in this sector.
Rwanda's target is for every household to be powered to electricity by 2024. However, the current standing is at 73% electricity powered and 22% are solar powered. Active use of solar energy has maintained low participation within COMESA's member states. However, thanks to the REEF project aimed at financially facilitating infrastructure, COMESA has received a $10 million grant from the World Bank aimed at implementing policies to reduce equipment costs and simultaneously in enhancing quality. Dr. Chipiego Cheluge, the Assistant Secretary General of COMESA, noted that there are a number of factors leading to people's mistrust of solar power.
There are a number of factors that lead to people mistrusting the use of solar, and one of them is the sourcing of poor materials from certain countries. And by the time a number of us use the cheap solar materials, then we lose trust in those materials, and then maybe also lose trust in solar energy. So the study has been carried out by COMESA, and we're going to listen to the consultants' report about their findings, so that all these member countries will also give their experiences. And in the end, we'll have recommendations that we are going to take to our Council of Ministers that will make policy decisions to enable this particular energy easily accessible and reliable.
The World Bank has also allocated $400 million loan to the private sector through the COMESA Commercial Bank to solidify their continued involvement in future projects. All member states of COMESA have been represented in Kigali for a summit intended on implementing policies to avail affordable high-quality equipment within the region. Residents of Mukama sector in Nyagatare district claim that they have been carrying sick people to the hospital on hammocks since the road to the hospital was destroyed. They say some people may die on the way to the hospital if this continues. The damaged road makes it difficult for people to travel to Mimuli and Nyagahita health centers in Gatsibo district. The damaged road also makes trading in Jihenjiri market difficult for people coming from Nyagatare, Gatsibo and Chichumbi districts. Masiko Gonzak, the deputy mayor in charge of economic development in Nyagatare district, says they will temporarily repair the road in order to ease the flow of goods and services in the sector while they wait for the fiscal year 2022-2023 budget to permanently repair the road. We shall come back with economic items after the advertisement.
Urifuza kumenya ubuhinzi ndetse n'ubucuruzi bw'indabo bukorera mu Rwanda. Bella Flowers ni umushinga ugamije guteza imbere ubuhinzi bw'indabo ndetse no kuzamura ubucuruzi ku isoko mpuzamahanga. Nyarukira kuri YouTube channel ya Radio Imanzi wirebera ubuhinzi bw'indabo muri Bella Flowers. Witinda kora subscribe kugira ngo urusheho kujya usobanukirwa byimbitse ku buhinzi ndetse n'ubucuruzi bw'indabo binyuze muri Bella Flowers.
Economic news is a regular feature on Radio Imanzi. The Rwanda Stock Exchange Market Report. The trading session recorded its turnover of 3,034,800 Rwandan francs worth of bonds traded in one deal on the fixed income market and 927,800 Rwandan francs from 12,100 shares traded in 9 deals on the equities market. M10 Rwanda counter closed at 176 Rwandan francs. The trading session recorded a turnover of 88,000 Rwandan francs from 500 shares traded in one deal. Bank of Kigali closed the counter at 272 Rwandan francs. The trading session recorded a turnover of 326,400 Rwandan francs from 1,200 shares traded in 2 deals. I&M Bank closed the counter at 43 Rwandan francs with the trading session recording a total turnover of 421,400 Rwandan francs from 9,800 shares traded in 4 deals. Bergua closed the counter at 170 Rwandan francs. The trading session recorded a total turnover of 68,000 Rwandan francs from 400 shares traded in one deal. Simergua closed the counter at 120 Rwandan francs. The trading session recorded a total turnover of 24,000 Rwandan francs from 200 shares traded in one deal. The rest of the equities counters closed with Equity Bank at 440, Kenya Commercial Bank at 370, National Media Group at 1,200, Uchumi Supermarket at 104, and RH Buffalo closed the counter at 526 Rwandan francs as the market closed. The currency market review of today. The Kenyan shilling buying price was 8.5 Rwandan francs and the selling price was 8.7 Rwandan francs. Tanzanian shilling buying price was 0.44 and the selling price was 0.45. Ugandan shilling buying price was 0.26 and the selling price was 0.27. Burundian franc buying price was 0.49 and the selling price was 0.5. The US dollar buying price was 1,028 and the selling price was 1,049. The British pound buying price is 1,175 and the selling price is 1,199. The euro buying price is 1,031 and the selling price is 1,051.
Some items of international news on Radio Imanzi.
Tanzania has announced the abolition of the recently introduced levies on electronic transactions, which took effect on August 15th, following a public outcry. The decision was announced by the Minister of Finance and Planning, Dr. Mwigulu Nchemba, in Parliament after the question and answer session. He said that the government had reduced the scope of charges, stimulating the use of electronic transactions to reduce cash, simplifying charges, and preventing double taxation on the same income. Uganda has confirmed one case of Ebola in the central Mubende district. Senior Ministry of Health staff rushed to Mubende to investigate after a known number of residents succumbed to what was initially reported as a strange illness. It was later confirmed an outbreak of Ebola virus disease in Mubende district, Uganda. The confirmed case is a 24-year-old male, a resident of Ngabano village of Madudu sub-county in Mubende district, who later died. Nigeria's anti-drug agency has seized 1.8 tons of cocaine valued at $278 million at a Lagos warehouse in what it described as likely the country's largest bust ever. 5 people, the warehouse manager and 4 drug barons, including one profiled as a Jamaican, were arrested in connection with the drugs, according to the National Drug Law Enforcement Agency. The suspects were members of an international drug syndicate the agency has been trailing since 2018. The agency said the drugs were found in a secluded estate in the Ikorodu area of Lagos at a time when the cartel was trying to sell them to buyers in Europe, Asia, and other parts of the world. UN investigators say they believe Ethiopia's government is behind ongoing crimes against humanity in Tigray and warn the resumption of the conflict there increased the risk of further atrocity crimes. In its first report, the Commission of Human Rights Experts on Ethiopia said it had found evidence of widespread violations by all sides since fighting erupted in the northern Tigray region in November 2020. The commission, created by the UN Human Rights Council last December and made up of 3 independent rights experts, said it had reasonable grounds to believe that in several instances these violations amount to war crimes and crimes against humanity. The experts listed a long line of horrific violations and extrajudicial killings to intentional starvation and rape and sexual violence perpetrated on a staggering scale. With that, we come to the end of tonight's edition.